Hi, this is Dr. Gams again, and welcome to part 5 of the 5 steps in selecting a cosmetic dentist. What we hope to do today is talk to you a little bit about titles and about fees to finish up this sequence on helping you select a cosmetic dentist. Because as we've said in the past, cosmetic dentistry is not a required subject. It's not something you have to do for your health. It's something you're going to do to make you feel better, look better, and to improve your smile. So that's not something that you have to do. In this day and age, in these crazy economic times, it involves your discretionary income. So you better use it wisely. So hopefully in parts 1 through 4, we've given you some ideas and some thoughts that will help you in selecting a cosmetic dentist. In this part, we're going to talk to you a little bit about both titles and about, which also means credentials, and about fees. First of all, if you're ever in the New York area or you'd like to come and see us, there's our phone number. And you can also get more information from our website. We have a free report for you at gansdental.com. Just click on the banner at the top and we'll be happy to send you a free report that goes into a little more detail about cosmetic dentistry and some of the pitfalls that you may come into. But for the purpose of this little presentation, let's first touch on titles. Because you have to understand that beware of titles that mean nothing. Just because somebody has some letters after their name or they've taken a course here or there doesn't mean they have the expertise you need. Now, that doesn't preclude, certainly the DDS or DMD degree, because you have to be a dentist to do this. But there are all kinds of titles out there. And just because somebody read some books and took a written test doesn't mean they can do dentistry. That's just the realities. Now, a title does not guarantee success or expertise. All it does is mean they've passed some level of test. And there are all kinds of organizations out there that credential themselves. Now, once again, there are organizations out there that do a fairly good job. You have to be very careful. You have to be able to look at the dentist, see the patients he's treating, and see actual case examples. Don't look at the stuff that they bought. There are plenty of companies, marketing companies out there, that will sell dentists before and after pictures that they can put their names on, etc. You need to see real, actual case examples. You should talk to those patients. Get their phone numbers. Speak to them away from the office. Should you get real ideas of what's going on? You don't want to see them in the office where they're hampered by the dentist standing over their shoulder or a staff member. But you want to speak to them away from the office and ask them sincere questions. And the best question is, would they do it again? If they were going to do this all over, would they do it again? And would they do it with this dentist? Important question. Understand that not all dentists are the same, in much the same way that all accountants and lawyers and physicians are not the same. All dentists have different levels of training, and truthfully, dentists with the same level of training have different expertise. It's a very technically oriented skill. There are lots of artists out there. Not all of them are good, and yet they're all artists. So the dentist that you're going to see needs to have an understanding of what really goes into providing you the kind of care you want. So the best, you have to taste it. And the only way to taste it in dentistry is to look at previous cases. And understand that a crown is not a crown is not a crown. Not all dentists perform the skills in the same way. A lot of that relates to the laboratory they use. There are laboratories all over this country, and unfortunately lots of dentists, even today, send their work to the Philippines, to Russia, to China, to Korea. You would never know the difference, because you have very little way of evaluating that. But I will tell you, point blank, that there are wonderful laboratories out there all over this country. There are very mediocre laboratories, and then there are some that are downright terrible. Your restoration is only partly created by the dentist. The rest of it is created by the aesthetics and the skills of the technician handling your dentistry. You want to make sure that the dentistry being done is to the standards that you require. This goes back to video number 1, which talks about what your wants and needs are. If your expectations are high, you better be aware of the fact of what kind of laboratory the dentist is using. And it's not so much the name of the lab, but see previous cases. That's really what's important. So titles are not all that critical. Now, once again, saying that, I happen to be a prosthodontist. So, of course, I think my title is very important. But I'd be happy to show you befores and afters of hundreds of patients. And you can see those online to give you some example of what we do and compare it to what other dentists have done. Now, one of my favorite topics is fees. Because cheap is cheap. I mean, if you're going to use an inexpensive laboratory in the Philippines, you are just not going to get the same kind of restoration I get from the laboratories I use in California and in New York. It's just not going to happen. If the dentist you're going to is going to spend 1/5 or 1/6 of what I spend on my laboratory bills, he's just not going to get the same quality. That is just the fact of life. Now, expensive, unfortunately, does not necessarily mean better. There are plenty of dentists out there who are not skilled themselves, who still send their laboratory work to very fine laboratories, who, because they need the business, will go ahead and do the restoration anyway. And because it looks good doesn't mean it fits good. So that is a kind of a problem. So being expensive does not necessarily mean you're the best. But being cheap sort of means that you can't provide the best of care. You need to evaluate that. What's really important is value. You have got to get value for what you're spending. If you're going to someone who's going to charge a reasonable or even expensive fee, then you should get value for that fee. That not only means in the quality of care you get, but the final restoration that's provided to you. And you should be able to see it, you should be able to touch it, wear it, evaluate it, criticize it, critique it, be part of the process, and you should not accept it until you're happy with it. Now, you understand, too, that fees are more than just profit. Every patient I've ever treated think they bought me my car or my house or whatever, and that's pretty much true, because that's how I pay my bills. But the fee you're paying the dentist is not all profit. A large percentage of that, especially in cosmetic dentistry and implant dentistry, goes to the laboratory. A ridiculous percentage of it. So please, when you do talk to the dentist, or you go to a cosmetic dentist or implant dentist, or both, please make sure you understand that the fee you're paying, a lot of that relates to the care they're giving you, the time they're willing to spend, and the laboratory fees they are willing to spend on your behalf. Once again, it's overhead, it's their expertise, and the relationship that they want to develop with you. This is a long-term relationship. Understand that when you have cosmetic or implant dentistry, you're pretty much married to the cosmetic or implant dentist or both that you're seeing. This is not a short-term relationship. The value not only that you place in this, but the value they place in it, and the value of your relationship is probably the most important factor in all of these 5 videos. Well, I hope you enjoyed these videos. I really do. I hope that I've given you some ideas, and I hope I've given you some thoughts. If you have any questions, please feel free to call me at my office. That's at 516-741-1230. Our website, you see at the bottom, it's scansdental.com. We're here to help in any way we can, so that you can make the proper selection when it comes to your dental health. We hope you enjoyed these videos, and we hope to see you soon.